Good morning, everyone, and welcome to the Wellbeing Charitable Foundation Caregiver Teleconnection. We're in the middle of a series right now called Our Health is Our Wealth, a health promotion series for caregivers. We've had nutrition and physical activity. Today, we're going to talk about mental health and some of the most difficult issues associated with mental health for caregivers. And with that, I'm going to tell you something about our presenters. Lucy Barylak has a master's degree in social work from McGill University. That's our dear Lucy. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges and on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including the Wellbeing Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mother for about 10 years. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually on the web. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. And with that, Elliot, Lucy, thank you so much for being here today.
Well, thank you so much, Evelyn and Minerva. Thank you, everybody, and welcome, really welcome to this series. So we are talking today about mental health, but before I go any further, I just want to remind everyone that our session is a 1-hour session, but after the hour, we're going to close the recording, and Elliot and I will stay on for another half hour for any questions that anybody has regarding personal questions or comments. So with that, I'm going to start the presentation of mental health. I want to share some statistics with you. An estimated 44 million Americans aged 18 and older provide unpaid assistance and support to older people and adults with disabilities who live in the community. So the value of this unpaid labor force is estimated to be at least $360 billion annually. Nearly double the combined cost of home care health, which is $43 billion, and nursing home care, which is $115 billion. So evidence shows that most caregivers are ill-prepared for the role and provide care with little or no support. Yet more than 1/3 of caregivers continue to provide intense care to others while suffering from poor health themselves. So research shows that family members who provide care to individuals with chronic or disabling conditions are themselves at risk. Emotionally, mentally, and physical health problems arise from complex caregiving situations and the strain of caring for frail or disabled relatives or friends. That's a lot of money that is being saved in the annual year. It was really quite fascinating to see that number. Studies consistently report that levels of depressive symptoms and mental health problems among caregivers than among their non-caregiving peers. Estimate shows that between 40 to 70 of caregivers have symptoms of depression, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for major depression. Both caregiving depression and perceived burden increases as the care receiver's functional status decline. Thus, higher levels of clinical depression are attributed to people caring for individuals with dementia. Studies show that 30 to 40 of dementia caregivers suffers from depression and emotional stress. And we know that depression and anxiety disorders found in caregivers persist and can even worsen after the placement of a patient in a nursing home. Many caregivers who place their relatives report that their depression and anxiety to be as high as it was when care was in the home. So that's really important to keep in mind. Depressed caregivers are more likely to have coexisting anxiety disorders, substance abuse, or dependence, and chronic disease. Depression is also one of the most common conditions associated with suicide attempts.
I think before we go further, we should see if anyone has any questions or comments, because this is a lot of compelling data, but also concerning.
Very concerning.
So if you're on the phone, please press *6. I can have a little website. I can see you've done that. Or if you're zooming in, you know what to do. Put up your hand, go to the chat room, or unmute yourself. And we'd love to hear from you.
We have a comment in the chat from Diane. I'm caring for two parents with dementia. One is in my home and the other in an outside home. It's very tough, in all caps. I can only imagine.
Well, it's certainly justified with the statistics and what the research is saying. It's really very difficult, and caregivers can be very at risk for developing depression and anxiety. And as the research says, especially for those who are caring for someone with any form of dementia.
And I just want to add, this is a little tangential, but we're so lucky to have Lucy and Elliot, looking at this, because there's so few people who are looking at aging caregivers. There's so few people. How long has it been since COVID is over? And we still have very few statistics on, the caregivers during the COVID and what happened to them and how they turned out, how, if they got long COVID, if they, suffered more, so thank you, Elliot and Lucy.
Of course. Thank you, Evelyn. Adriana shared caring for my dad with Alzheimer's full-time by myself. He still lives at home and I'm working from home full-time. The stress is unreal. I can well appreciate that.
And that's why I'm so happy that you're on with us today, because we'll give you, just to understand it and to make sure that you do take care of yourself.
Absolutely. And I hope also that you perhaps might join us next week when we focus on stress management, because you mentioned stress specifically. And that's something that we're going to be talking about. And back to your point, Evelyn, it is so surprising if you do a search to find new research or data about caregiver stress, how little is actually out there. And Myra shared many caregivers I know are, I guess, on some kind of medication to address stress and anxiety. This is very concerning. A doctor wanted to prescribe something for me, but I was scared to take it. And I think that's something that we've talked about during our program before, that sometimes medication can be helpful for people, but and a lot of the times for caregivers, what you're going through is situational, and medication can only do so much. Please go ahead.
I was going to say I will be speaking a little bit more about medication and just a little later on.
Another comment in the chat: I'm a caregiver specialist and also responsible for the care of my mother-in-law. Even though my mother-in-law is in assisted living, the stress is unbelievable. I am also her power of attorney. And just like Lucy was sharing, I think a lot of people can share that experience. It can be equally, if not more stressful sometimes when someone is in placement. And part of that also has to do with their declining health and the reason why they're in placement. So it's a very complex stress, really, for caregivers.
For sure.
I'm going to switch gears a little bit, building upon your last point here about suicide, Lucy, because suicide risk is actually highest among seniors. And it's something we really don't talk enough about. Back to that research point, if you look at suicide risk among caregivers, there's even less data and research. And it's something that we should be paying more attention to. According to the National Institute of Mental Health, suicide was the 10th leading cause of death in the US in 2019. So that is ahead of the pandemic. And among older adults in particular, suicide has been a significant concern. I was reading some research actually reports that most seniors who do successfully commit suicide have seen a primary care physician within 30 days of that suicide attempt. And in addition to that, roughly 1/4 of all men who commit suicide who are seniors don't discuss their suicidal ideation or their depression at all. So this is a very big concern. In addition, according to the National Council on Aging, while older adults make up about 12% of the population, they make up about 18% of suicides. And men 65 and older face the highest rate of suicide among all populations. And even more specific to that, it's white men.
With a gun. Yeah.
Which is one of the few times where you'll see that white men are I guess a majority and a minority all at the same time, but certainly something we need to be paying more attention to. So why is this happening? Suicidal behavior is common among older adults for many reasons, and loneliness has been found to be at the top of that list. Many seniors are homebound and live on their own, and if their spouse has, for example, recently passed, or if there are no family members or friends nearby, they may lack social connections, and it's harder to make those connections as we age. Other reasons for suicidal intent among older adults as well include grief. As we get older, we experience more grief in our lives because more people around us are passing. My grandmother always used to say that it wasn't the golden age, it was the opposite, because it was always so sad for her when she would lose friends. And many people do wrestle with their own mortality and experience anxiety about dying. And for some, this can be called the age of loss. And it's overwhelming, and that can certainly intensify feelings of loneliness. And other reasons include chronic illness and pain. Older adults are more likely to face illnesses and chronic disease such as arthritis, heart problems, high blood pressure, and diabetes. These conditions can bring on pain and loss of mobility that compromise quality of life. I had just read an article, actually, because I guess things are popping up in my Google feed based upon the research I was doing on this, but it was rumored or speculative that Robin Williams committed suicide because he had been diagnosed with Lewy body dementia. And whether or not that's true, I'm not sure. It had been previously reported that he suffered from depression, but either which way, obviously there was an impact to his quality of life. But he's one example. The other interesting research that has come out of limited research is a 2021 study that found that adults with mild cognitive impairment and dementia had a higher risk for suicide. And that was why I brought up the example of Robin Williams, whether or not that might be true. Decline in cognitive function can impact a person's decision-making abilities and also increase their impulsivity. So the most recent data that I could find was published last October, and it looked at suicide risk of caregivers of people with dementia specifically. And because there is such limited data available on the prevalence of suicidal ideation, suicide attempts, and suicide rates among caregivers of those with dementia, this most recent research actually examined findings from 194 studies before it, and it included 1,209 informal caregivers. That's a large population for a study. The average caregiver age in the study was 63.9, and of the participants, the 1,209, 74% of them were women. The prevalence of suicide ideation varied across studies, some of them as little as 4% and others as high as 78%. One study found that 1 in 17 caregivers of patients with dementia died by suicide. So what is the conclusion here? It's that the prevalence of suicide ideation is high. It affects certainly many caregivers of patients with dementia and other illnesses. And these findings suggest that we need to have more intervention, more discussion about this among this at-risk population. So what can we do and how? We know that we have a lot of healthcare workers, fortunately, that participate in our programs. If you are a healthcare worker, please share this with others. Pay more attention to the affect of caregivers that you work with. As I had mentioned, a majority of these individuals who attempt suicide have seen a doctor within the last 30 days, but we know that primary care visits are so brief and doctors are so busy. So oftentimes they don't spot things that they should. It can also be very difficult to address the conversation, but a lot of experts and mental health clinicians say that it's important to be direct with people. You can ask questions like, are you thinking about suicide if you really are concerned? And how can I help you? That's where that how is so important. It can initiate conversation in a supportive and unbiased way. And it's also an open-ended question. So you won't get a yes or no answer, hopefully. Be sure to listen to what people share with you and acknowledge the emotional pain that they're experiencing, and help the person stay focused on all the reasons why they should want to keep living. Keep them safe if you can. Find out if the person has already made any attempts on their life. Do they have a specific plan in mind? We know that people that have more planning have a greater likelihood to follow through on those plans. You can ask people what they're planning to do tomorrow, if they have a vacation planned, if they're planning to watch something on TV later in the week. It can be innocuous, but if you see that people have some plans, then that's usually a good sign because it means that something is not going to be imminent. Nevertheless, it's really important to call for help if you are concerned. So, of course, we have here the number 988, which is the mental health hotline, and they can connect you with the Suicide and Crisis Lifeline. Everything's connected now, which is very helpful. And someone who is at imminent risk for suicide may require more intensive intervention, but you can let those people at 988 assist you and help to provide that direction. It's also really important to help all seniors and caregivers to connect. If a senior in your life, for example, is depressed or suicidal, it's important for them to have support systems they can rely on. This is one way that we can help to prevent crisis. So that includes, like I said, 988. It's a hotline that's free and easily accessible for anyone in any community. You can also find out if the person at risk is currently seeing a mental health counselor. And if not, SAMHSA, the Substance Abuse and Mental Health Services Administration, does have a searchable confidential directory, which we'll include in our resources to help you find mental health providers across the US. Most importantly, follow up. Studies have shown that following up with people can show them that you care and can really reduce risk among high-risk populations. So if you've had an initial conversation with someone, whoops, what just happened? Hold on, sorry. If you have had that conversation with someone initially, then you should certainly follow up and see if they can benefit from perhaps more help, or if there's anything further that you can do. Bless you. As I said, we will be providing these resources after our program. Does anyone have any questions before we continue?
Kim? Kim, did you want to talk to us?
No, I'm so sorry. I accidentally hit the wrong button.
No
I've done it
worries.
many times. Well, Elliot, I have a question.
Yeah.
In my many, many years of working with elderly and disabled people and their caregivers, one of the biggest things when you ask about why, the suicide rate is so high is because we don't have the resources for people. How many caregivers have we talked to that can't get respite? They can't get somebody in their home to help them out. They're burned out, they're tired, they need more help. They don't want to go on Medicaid because they've got $4,000 in the bank and it's the only thing that keeps them from being poor.
Sure, of course. So one of the good things I think to have come out of the pandemic is our use of telehealth, which we're going to talk a little bit more later. This is something actually that Minerva had brought up in a previous session earlier this year about the wider availability of telehealth for mental health. which can be so important for people who do need respite, as you were saying, Evelyn, who might not have access to it. And so you can actually have appointments with a clinician or talk to someone from your home. There are also a number of online support groups, and we've talked about 7 Cups, which is the world's largest online support community. They have specific groups for at-risk seniors who are dealing with isolation, loneliness. There are so many resources now, more so than we had a couple of years ago.
Thank you.
We have, oh, go ahead. I
No.
was just going to read some comments here
Sure.
from the
Go
chat.
ahead, Elliot, and
chat.
then I'll come back.
Sure. Deborah said you hit the nail on the head, no resources. And yes, I mean, I'm not going to say that we have a bounty of them, but there are more than there were, certainly. Diane said, I've used BetterHelp, which has been really good telehealth. That's great to hear. And BetterHelp is one of those telehealth programs I was talking about. The name of the support group website, I'll enter it into the chat box also in a moment, but it's called 7 Cups, and it is the world's largest online support community.
I do want to say that if there's any healthcare workers in our chat today with us, or if you're a caregiver and know other caregivers, one of the things that you said is very, very important is follow-up. If somebody talks to you about it and maybe you're very compassionate and you're understanding and you're there for them, please do follow up, because that reassures people that they're really not alone. And it might be as simple as, just a telephone call, whatever it is, but it could make a very big difference.
My last comment is that in the US, we do spend #1 in healthcare of all OECD, I think it is the economic development. There's some sort of an organization. I used to preach this statistic, but we're #1 in primary care spending, and we are number 25 in social support spending for healthcare. So that shows you where we place our value on mental health. And to me, they're so incredibly linked. If you have no mental health, you have no physical health. But that's just my opinion.
Mine too.
Okay. All right. So, we know that caregiving can be very rewarding for many reasons, and we're never, ever taking that away. In my own experience, I know that it was very rewarding for me as well. But we also know that caregivers experience a lot of difficult emotions, in the process of providing care. So I want to kind of go over them, even though we know them, but it's so important to recognize them and own them. Many caregivers feel frustrated, overwhelmed, angry, sad, and resentful. These feelings can have a serious impact on your physical and mental health, especially if you have no outlet for these feelings. As a family caregiver, if you have no, you as a caregiver, most of the time you focus often on everyone around you, especially the person you are caring for. And most caregivers have numerous duties, from cooking meals to handling doctor's appointment, administrating medication, many times helping with bathing, dressing, and many other chores. So this level of responsibility can cause extreme stress. When left unmanaged, stress can really lead to anxiety. So there's first stress, which leads to anxiety and excessive worrying. Other symptoms of anxiety may include you're irritated, sleep problems, and trouble concentrating. These symptoms can make it difficult for you to fulfill your caregiving duties, which can then increase your anxiety over time. And this can lead to feelings of isolation, disconnection from others. It's almost like a circle. It's like a vicious circle that keeps going round and round. So it is so important to recognize if you do have these feelings, to be able to acknowledge them and say to yourself, something's going on. So having an anxiety and large stressors in your life can make you more vulnerable to suffering from depression, and vice versa. depression can make you more vulnerable to suffering from anxiety. When it comes to drinking alcohol or using other substances, unfortunately, some people may feel that these behaviors are their only outlet for their stress. Their anger, their sadness, feelings of isolation and disconnection are often the root of addiction, where a person uses substance often to escape the difficulties and the pains of their realities. So some people use substance to try to self-medicate their symptoms of depression or anxiety. And, and in the short term, people might find that it works, meaning it dulls their symptoms. However, long-term use of substances can increase depression and ultimately make these conditions much worse. So it's very important to keep that in mind. This is why substance use is considered a maladaptive or harmful coping mechanism. There's a lot of research on the ways in which long-term use of alcohol is related to increased depression symptoms and really to become very clinically depressed. So stressful caregiving situation may lead to harmful behaviors. We know that. As a response to increased stress, caregivers are shown to have increased alcohol and other substance use. Several studies have shown that caregivers use prescription and psychotropic drugs more than non-caregivers, okay? Family caregivers are at greater risk for higher levels of hostility than non-caregivers, which can obviously result in abusive situations. Partner and spousal caregivers who are at risk of clinical depression and are caring for a spouse with significant cognitive impairment or physical care needs are more likely to engage in harmful behavior towards their loved one. So all that I'm kind of saying is through the research to really acknowledge your feelings and don't just let them go, because they can escalate, they can turn into depression, they can turn into anxiety, and then many people cannot manage those feelings. And unfortunately, it can turn into anger and it can turn into an abusive situation. So I've said a lot and it's a very sensitive topic. So if anybody has any questions or any comments you would like to make, please do so, and we can go over them a little bit further for you.
We had one chat already on here from Myra, and it was, it just went away. Let me see.
Overeating or undereating
Thank
can
you.
be an issue because of easy access. A woman after my own heart. Next week, I'll talk about how stress is desserts backward.
I think, yeah.
Obviously, I use humor as a coping mechanism. But Myra shared there are also functional burnout caregivers. I love that, actually. That's so true. They keep on going. And yes, the concern is what will it do to their immediate or future health, even though they may think they have it under control, myself included.
Mm-hmm.
And Diane shared, I actually quit drinking when I became a caregiver. And I've heard that before too, because people do feel like you need to be hyper responsible. You can never be impaired.
I just want to say that addiction is not only alcohol for caregivers as well. Addiction can be even shopping addiction, being on the internet too much and eating as well. Gambling, there's many addictions that, and there can even be sexual addictions. It's just a matter of a way to try and cope with the situation that you're going through. But it's not a good resolve, because at the end of the day, it's more harmful. And getting the right way of dealing with things and being able to recognize is really very, very important.
And I think for many caregivers too, there is no instant gratification in the experience of caregiving. And we live in a society that is built upon instant gratification. So the immediate pleasure of that retail therapy or being able to shop online, as you're saying, even having too much alcohol or taking benzodiazepine to go to sleep. These are things that can give us an immediate pleasure that the other experiences in our lives don't as easily do. And that's dangerous. We have another comment. Iris shared, I stopped my stress drinking in January because I became concerned for my health, and also because I have to be able to take action at all times to take care of my mom. And we know that you also exercise. And so, not drinking is very helpful when you want to have all your energy to dedicate it somewhere good, to channel it rather.
The other thing also is to keep in mind that unfortunately seniors, for many reasons of health, take a lot of medication, and that accumulates too. And there is a risk that you can over-medicate yourself. So it's really very important to take good care of yourself and to make sure that even over-the-counter medication, sleeping pills, over-the-counter, you have to be careful with those things. Never do any of that before speaking to your doctor or to your pharmacist.
And long-term use of them is linked to development of dementia.
Yes.
So I think that's a good segue for mental and physical health. And I was talking earlier about what Minerva had shared about the online availability of mental telehealth. And in addition to that, many health insurance programs are now also covering substance abuse treatment, with many therapists available via telehealth. And many counselors or clinicians that you can find through telehealth do have experience with caregiving and with also substance abuse. So I really encourage people to check with your health insurance and to find free support groups in your local area. Call 211 or 988. 211 is the local resource hotline. 988 is the mental health hotline, but they might have some great resources available in your specific area as well. As I said before, I really believe that our mental health is inextricably linked to our physical health and vice versa. A lot of how we learn to cope, and this is something we actually learn in childhood, is something that scientists are now also linking to our genetics. So it's important to think about how your parents might have coped, or what you saw growing up with whomever raised you, how they dealt with mental health. And do you see similarities? Do you see differences? In a previous program some time ago, I had shared that I noticed growing up that when my mother was angry, she would either write or she would bake. And it's no wonder that early in life, I learned that nothing could quell my feelings quite like food. And of course, there were always a lot of baked goods to eat. So I think many of us learned this. And that's also why many of us have turned to food as a source of comfort during the pandemic. That led, in fact, to many of us then feeling angry with ourselves for quote unquote letting ourselves go, as we call it. But in fact, we were really doing the opposite. We were coping the best we knew how at the time and keeping it all together. Now, as people, we're not good at giving ourselves credit for getting through tough times. And instead, we tend to get angry with ourselves for how we could have done it better. So this is another example of a relationship between our physical health and our mental health or well-being. We need to be kinder to ourselves and show ourselves what's called self-compassion. What's fascinating to me is that this experience that I'm describing of anger was something that was the topic of an article in the Journal of Alzheimer's Disease Reports published in November of last year. And the systematic review of literature looked at associations of anger and hostility with caregiver health outcomes. The overall findings indicated that higher levels of anger and hostility exerted a negative effect on caregiver physical health. Shocking, right? Higher anger control, so this is to hold your anger in, was associated with weight gain, kind of what I was describing before about the pandemic weight gain, which many people attributed to stress, lack of control, and anger over the situation. But we were keeping it all together during the process. It makes sense when you think of the old saying, it's not what's eating, it's not what you're eating, it's what's eating you. Somehow that never just clicks in my head. I guess that's something I need to work out in counseling. The study also found that people that expressed higher anger outward had higher glucose dysregulation, meaning that their blood sugar levels varied more. So in both cases, caregivers who either contained their anger or who expressed their anger had a change in their blood sugar patterns. And it's so interesting to me that both of these outcomes link to insulin levels in the body. This was the first study of its kind to measure evidence on the harmful effects of anger and hostility on caregiver health, and it highlights the need for preventative intervention to support family caregivers experiencing high levels of anger. So I want to read a chat that we received and also ask if anyone had any comments, but Kim shared, I so relate to the gratification concerns as due to my situation, I often feel so unappreciated and taken for granted. I work on my reactions to the issue. Thank you for sharing that. I think it's something a lot of people can relate to feeling, because the experience of caregiving, it's unlike many others in our lives, and no one prepares us for that.
If you're on the phone, please press *6. I have a little website and I can see that you have unmuted yourself. And if you're on Zoom, please chime in.
I would suspect that caregivers at any point in their journey have dealt with issues affecting their mental health and also the mental health of a loved one, especially when you see that declining. I think one of the greatest challenges for caregivers can be about handling the challenges of interpersonal conflict while being a caregiver. And I have a former colleague, we worked together about 15 years ago, she is a caregiver to her mother who has Alzheimer's. We'll call her Melanie, and she is one of our participants today, but for anonymity, we'll call her Melanie. And Melanie had reached out to me with this question, and Lucy, I wanted to pose it to you because I think a lot of people can perhaps share. So Melanie lives with her husband and their 8-year-old son, and her mom has Alzheimer's, as I mentioned, and lives with them. They relocated from Florida up to Maryland a couple of years ago. And as her mother's Alzheimer's has progressed, she has recently been demonstrating some aggressive behavior, which Melanie has been very effective at redirecting, and we've worked on how to do that, just like we tell all of our caregivers to do. But this behavior has become a little bit more commonplace, and it's causing conflict, actually, between Melanie and her husband. Her husband wants them to place her mom in a long-term care facility. But when they agreed initially to take her mom in, that was never part of the plan. And the change in her mom's behavior has caused her husband to be concerned about their son and his mental health, seeing his grandmother lash out the way that she has been. Recently, she tried to bite Melanie in front of Melanie's son, and he got very upset. He found it very traumatic. So Lucy, what advice would you offer here? I know it's a tough one.
It's a tough one. It certainly is. It certainly is a very difficult situation for all the family members to be in. And I'm glad that you clarified, because I wasn't sure in the beginning whether mother was only lashing out, of whether it was physical or just verbally, and now it's physical as well. Kind of changes the dynamics a little bit more. And really, my first question to Melanie would be, when did this behavior become more common? You know, when did it start become escalating? Did something happen to trigger the behavior? I think it's always important to identify the reasons if you can, because if you can, then you have a little bit more control of how to handle this situation. And my next question would be, when was the last time that her mother was seen by her doctor? There could be a physical or mental deterioration that needs to be addressed. She could have pain that Melanie is not aware of. She could have a urine infection. We talk a lot about that. And she's not able to express her needs, and therefore is lashing out, and now even physically lashing out. her meds may need to be reduced or increased, or even a new prescription. And they may find that she really does have a medical condition that needs to be addressed, or that her dementia has progressed. So that is really important. The first real step that I would say needs to be done. But I also want to tell Melanie that I can understand her husband's worries over their son. An 8-year-old should not be witness to any form of aggression. You have to really protect that child. So Melanie needs to understand that they both need to protect their son. Her mother may become physically abusive towards this child as well. And so the child should never be left alone with the mother, ever. And, and that sort of creates another issue. I mean, if you can never leave the child alone with the mother, what impact does that have on everyone's ability to work or socialize or whatever needs to be done? And also, is it time to look at other alternatives? And so what I would really suggest that the couple, as a couple, needs to put a plan in place to address all the present issues and find solutions together. I think she needs to have a real good heart-to-heart talk with her husband. They both need to be respectful and acknowledging each other's feelings and worries and concerns, and work together as a team. Again, the plan should include she has to have her mother assessed by a doctor as soon as possible to make sure that everything that needs to be taken care of will be taken care of. If the mother's behavior gets out of control, other alternative measures need to be looked into. I know it's not easy and it's difficult. And sometimes I've had caregivers who I've said, you've got to take that person to the emergency room because you cannot handle this situation. Or even the worst case scenario is to call 911. But the only way to be able to do a plan and to really work out is to talk about it. You can't repress it. Remember, we just talked about mental health issues and how you can repress your feeling. So sitting together with her husband and really having an honest talk about all the possibilities that could arise from the behavior of the mother. And again, if they cannot for any reason resolve this, it's very important that I think that they should go into couple counseling. A third-party person can always be very objective and help them to deal with a lot of these issues. So I can really go on and on more about it, but right now the priority is to make sure that this child is safe, to acknowledge each other's feelings, because it's come to a crisis. Remember, we talk about sometimes situation in the caregiving journey, everything seems to be going along just fine. And all of a sudden, everything goes downhill. And so this family is in a crisis situation and needs to really reach out for support and help. I would be very concerned if something did happen to this child, if for any reason, obviously not intentional, there could be an issue where child family services can be involved. And what you don't want is to have this child removed from a loving home because of a situation that is beyond their control, and that the person that's responsible for that, it has nothing to do with her. Her dementia has come to a point where she may not be able to remain at home.
Lucy, if you don't mind, I'd like to add that there are very good drugs right now to deal with aggressive behavior.
Yes.
So it's
Well,
really
that's what I
important
meant. Yes.
that the family be there, that the caregivers be there, mom and dad be there at the doctor's visit to explain what's going on.
Absolutely. And that's why I said the first thing is to go to a doctor's, because the medication may need to be changed, may need to increase. And you're right, Evelyn, there's a lot of medications out there today that can take the edge off. We're not talking about medications that puts the person into a trance. It just takes a bit of an edge off. But this needs to be explored. There are psychogeriatric assessments that could be done. Sometimes family physicians are not prepared to do that kind of an evaluation. So definitely you can ask to have a referral for a thorough psychogeriatric assessment for this person. but it's a beginning process of a family in crisis right now.
I really appreciate all of your input. And as I shared, I see that Melanie is participating, but was shy about approaching this as a question in our larger group. And you're certainly welcome to stay on with us after the hour. But Melanie presented this question to me actually 2 weeks ago. And so I'm very glad to know that the advice that I gave her is exactly spot on to what you're saying. I even took it a step further and suggested that maybe they take their son to the geriatrician as well, so that he can hear from the physician that this is a symptom of her illness and not something, just to hear it from a different party. Perhaps that could be just a little reassuring as well. And in fact, they did wind up going to see her doctor, and they did adjust her Seroquel, which seemed to really help so far in the last 2 weeks with this behavior. So that's been very helpful. And Haley wrote in the chat box to keep a record of the behavior, triggers, interventions to help the doctor, which is another amazing piece of advice. I had recommended actually aromatherapy, soothing hand lotion, anything like that. Again, redirecting, which was effective at first. And if anyone has any other tips that have been helpful for them, please feel free to share them. I do want to share a question that Diane posed, and she is asking, my mom can't remember much, so I have to repeat things a lot. It's hard to have patience, exhausting. Caregiving in general is so mentally exhausting.
It certainly is, and all the things that we've been saying. I know that Melanie tried to redirect the person, get them to do activities, distract them. It is exhausting. It's an exhausting journey to begin with. You always have to step back. And that's why Elliot and I talk about your wellness, your well-being, the idea of even a very, very simple little skill is if you're feeling that your body is really getting, your heart is pounding and you're sweating, whatever it is to be able to step back, take 10 big breaths. This is all the tips that it does help. It is a journey that is exhausting. And I have to tell you, I was on this journey for 10 years and it never stayed the same. It escalated and I had to learn all new tricks of how to cope.
I think
and how to take care of yourself.
Yeah.
Yes, I had to set limits. We've talked about that. We can talk a little bit more about that. You have to set limits. I knew that I couldn't do it all. I could not do it all. I needed help. And it was okay to ask for help because at the end of the day, it helped not only me, but it helped my mom as well.
And something that you said is so key, that the journey never stayed the same. And I think that's something that we, again, need to always reinforce, is that we need to be flexible because the journey changes, it evolves. There are better days, worse days. Myra shared, my mom was also placed on medication for aggressive behavior, paranoia, and hallucinations. Low dosages, and I keep notes on behavior to discuss with her neurologist and geriatric psychiatrist. Who could ask for better advice? I think that's a great piece of advice for other people to follow. And again, this is the second time that we've heard about journaling things. It's so helpful because it can help you get a better idea of what some triggers might be. And if anyone else has any questions, feel free. I am going to share our resources, which is our last slide for today. And hope that you do stay on with us after the hour if you'd like to have a more candid or anonymous discussion about mental health concerns. The session will not be recorded. And for those participating, please feel free to take advantage of those mental health services. I also want to encourage you to please join us next week as we talk about stress management. I mentioned I'll be talking about how stress, spelled backwards, is desserts. It's a little I guess for me, you have to temper things with humor. And back to Diane's point about having to repeat things, one way to look at things is that every day needs to have a little bit of pleasure in it. There are a lot of pain points in the experience of caregiving. And I think you need to balance the scales as much as you can so that your pleasure and your pain are somewhat at more of an equal balance. That can mean watching a funny show with your loved one. It can mean taking a walk if you have the ability to do that, or if you don't necessarily need respite to do that. There's so many things available to us in the home and outside of the home to support us. I had mentioned 7 Cups, which is not one of the resources I included here, but it is the largest online support community that is free. They don't have necessarily mental health professionals moderating all of their support groups, but sometimes peer-to-peer support can be one of the best ways to get what you need. So I hope you'll certainly take advantage of those.
Okay.
Before
I
we
want to thank you as always, such good advice. And I think we all feel like that. I want to thank Lucy and Elliot so much. Looking forward to the one on stress management, get some more good advice, and that's next Wednesday at the same time. We also have, excuse me, two other additional presentations this month. One on this Thursday, dementia and ambiguous loss. And that should be I don't quite know what that means. Let me read this. There are many types of loss that those age 65 and over experience, and they are not all related to death. Ambiguous loss. Also, we have on Thursday, the 27th, Dr. Jamie Heisman. If any of you were online and heard him last month, this is actually part 2. And he started last month with how to remove toxic people from your life. And there were many questions to him about how to do that if these people are family. And so he's going to tell us, how to develop a growth mindset as a caregiver, a growth mindset to protect yourself and, have the best life you can have. And I think that's going to be an interesting conversation too. So in closing, I'd like to say to all of you that you'll be receiving a questionnaire in a couple of days. And that questionnaire will come with the resources. If you're not registered, please get registered. Sometimes people share links or share phone numbers, and then you don't get the resources. And if you do need to register, call WellMed Charitable Foundation's customer service line, 390-6491. You'll not only get registered and get the resources, but you'll also get this monthly calendar, which, as you can see, this month we had 13 fabulous presentations, which have all been recorded in podcasts, which you guys can, refer somebody to or look at them again yourself. And I'd also like to say one thing to caregivers before I close. Take care of yourself first. You're not Superman. And with that, thank you to our presenters, always the best information, the newest, the research that you do is amazing. Thanks to the caregivers for what you do. Please take care of yourself. And thank you to the WellMed Charitable Foundation for all that they do and with their Stress Busters program, this program, the podcasts that are on their website, the clinics that they support. They have one of the few geropsychiatrists in the country down in Corpus Christi, Dr. Proderio. They have tried so hard to put together a full system for caregivers. So with that, I want to thank you all so much, and I'm going to stop the recording. But stay on, because Lucy and Elliot are going to stay on if you want to.